Thank you very much for coming this evening, everyone, and to the presentation, Your Food is Medicine. This is presented this evening by the Robert Fishman Institute. Robert Fishman is a pharmacist located in Hollywood, Florida, and he graduated from pharmacy school, Columbia University, the only Ivy League pharmacy school in 1955, where he was groomed to work for the pharmaceutical companies. And after working a year, he decided against it and now owns the largest compounding pharmacy in Florida. We are dedicated to training pharmacists, physicians, and anyone else about how we need to go and look at physiology and biochemistry in medicine. And evidence is nice, but it's not really the direction we're headed in. So today, what I want to talk to you about is the pharmacology of food. 2,000 years ago, Hippocrates knew that food was medicine, and he said, let your medicine be your food and your food be your medicine. And I have some pharmacy students today in the audience, and they'll be presenting some things that they found. And one of the things I have them do is eat a meal with me, and then they have to go to the scientific literature and see how all of our food affects our bodies. Today I have a very special guest that I'd like to bring up, and but before I do, I'd like to show you one of the important things, which is the biochemical map of the body. And if one of my pharmacy students is here to help me, maybe put it up here. And I don't know if you can see this, but this is every biochemical reaction in the human body. And all of these biochemical reactions are driven by vitamin B12 and vitamin A and vitamin C. And so when we don't get our vitamins and we don't get the nutrients we need to run these reactions, what do you think might happen with the reactions? They break down and don't work. So if for instance, your nerves are run by fat and B vitamins, so you don't have enough B vitamins, you might start getting nerve problems. And today, especially in children, when we were all young, you remember we didn't have all this attention deficit, autism. Autism was 1 in 5,000. Now it's 1 in 93 children that have autism, and other childhood diseases like type 2 diabetes that were unheard of. What I'd like to do is introduce to you a very special guest. It's Dr. Judy Wolger from University of Miami. She's the director of the Executive Medicine Department. She's an board certified internal medicine physician, and she's also in the book 100 Best Doctors in America. So if you'll come up. And what I'd like you to talk about is, first of all, what do you think of the biochemical pathway, and what did we learn about nutrition when we were in school?
Well, the biochemical pathways look tremendously intimidating when you see them put out like that, but we know how important they are on a day-to-day basis. Unfortunately, in medical school, most of what we did was memorize it and forget it. And so when we get into the daily practice, we're really not using it so much. Well, until I met you and Dr. Fishman, then it kind of comes back. As we learn more about nutrition or relearn more about nutrition, we're putting it back in the daily practice, and we're seeing the results.
And how do you think that works for your patients and the outcomes?
Well, it works really well for me. I feel like I've had this sort of evolution of my patients. Maybe they evolved with me, maybe they were attracted as I learned more working with you and Dr. Fishman, but there are a lot of people nowadays who simply don't want to take the prescription medications. I felt like there was a time where people would just come in to receive their prescription and then walk out the door, and there was sort of not a lot of involvement. And now there are a lot more people who are coming in and saying, I don't want to take this prescription anymore, isn't there something else I can do? And that's when I've had to turn to you and your group to see if there are things we can do through foods or other supplements to see how we can kind of get around or use those pathways to create the good results.
And what about an integrative approach where I think we work together really well, that we see patients and we integrate, because there is a time for medications, right?
Well, absolutely. I spoke to a patient today who was working with someone who refused to use antibiotics, and I don't function that way. I'm board certified in internal medicine. I practice traditional medicine and use the medications when they're appropriate. And at the same time, explore with you and let you explore with the patients how maybe some of the other pathways can be taken care of. So for me, it has to be bridged together, and I don't know everything that you know. I know my traditional sort of medicine, but like to use a combination.
Okay, great. Well, thank you so much for being with us tonight. We appreciate it.